I want to talk for a few minutes about spring events that are coming up. Last year, when COVID started spreading in Ohio, we issued guidance for these events to happen safely. Today, we're announcing the next steps to ease some of our public health measures while mitigating the spread of COVID. We know that the coming months will be critical, and we worry about the variant. That's the one kind of caveat to what I'm going to say. We don't know exactly what's going to happen with that, or what the effect is going to be, but we're optimistic. I'm very optimistic. We look about Ohio today, and as we see for a good part of Ohio, the snow is melting. We're finally seeing the ground. We have a lot of signs of spring out there, and we have a lot of things to be happy about as we move forward. Many people have asked, what about our prom? What about our graduation? What about the county fair? What about this parade? What about this festival? And so in the next week, we're going to try to give guidance in regard to those events. The guidance is based on what we know now, February 25th. And as the facts change, then we will adjust. We hope they go in the right direction. We're optimistic that they will, but we don't know that. And so we will continue to adjust. But the guidance that we're going to start with, we hope, as we move forward, we will be able to lessen up and expand. But the whole goal here will be for all of us to get back to where we want to be, get back to what our life was before the pandemic. There's a bridge to that life, and we have to take the bridge. And the bridge is really built on two things. One is vaccinations, and the other is to continue during this bridge to continue to wear masks. And there will be a point in the future, we have the herd immunity, where we will not have to wear the mask, and we will be able to take the restrictions off. But we're now crossing this bridge, and I'm happy that we are here. 1.5 million Ohioans have already received their first shot, and many of them their second shot, and we're moving forward. So let me talk about that bridge for a moment before I start talking about some of the new ways to do things and how we're going to pull back our regulations. And I think people will be happy to hear about this. So let's talk first with vaccinations. Again, 1.5 million Ohioans have received their first vaccination. A number of those have received their second. We're moving forward. But we also know that there's been frustration from Ohioans. They've not been able to receive a shot, even if they are eligible. There's been a lot more demand than there has been supply. And I'm not telling you that is ending, but what I am going to tell you is things are looking a lot better. So next week, we already know we will have 310,000 first shot doses in the state of Ohio. We've finished the vaccination of our school personnel, and we've also seen an increase in vaccine coming into Ohio from the federal government. So we'll be adding more sites, adding Myers, Walmart. Those are, you have to check. Not everyone will have it, but a number of the Myers, a number of the Walmart will have it. We're going to add a number of independent pharmacies. We know a number of you like to go to your independent pharmacy. That's how Fran and I grew up, and that's what we still do. We go to the Cedar Care Pharmacy, and when we were growing up, we went to Urbon Johnson Drugs in Yellow Springs. And so we understand about independent small pharmacies. And so the pharmacies that have signed up will be able to get that vaccine. We'll be getting that vaccine next week. We should also mention that Rite Aid continues to have the vaccinations, Kroger, CVS, Walgreens. We're also going to be able to send more vaccinations to the health departments. and more vaccinations more doses to the hospitals. The news tomorrow and today and this weekend will also be about Johnson & Johnson. And we don't know when that green light goes on. We're assuming it's going to go on in the next few days, but we don't know that. But when that light goes on, we believe, based on what information we have from the federal government, that the first week, this would be an additional 90,000 doses. We are told by the federal government that the second and third week will be less. We don't know how much less. So this is going to be a ramp up very quickly and then down. But to make it very clear, the number I gave you before, the 310,000, did not include the Johnson & Johnson. So we're waiting. Can't announce those yet, can't allocate them yet, but we think and pray that they are coming. I want to look at the chart that we have. This is statewide vaccination chart, and if you can look on there, and this is something that I look at every day. And to me, it's aspirational and should be aspirational for all of us because we need to continue to get shots in arms. And as I said, we're going to have a significant number more shots this coming week. Doesn't mean there won't be people who still won't be able to get it, but I think obviously a lot more people are going to be able to get their shots. And then we have to continue to move forward on that. If you look at this chart of people 80 years of age and older, we are now over 60%. Of people 75 to 79, we are over 52% of that group. Those 70 to 74, we are at 40%. And those 65 to 69, we are at 26, almost 27%. So we need to see these numbers keep moving forward. I know some 60-year-olds and 50-year-olds have asked us, when are we going to see movement and when can we get it? We need to drive these numbers up that we have, the number of our people over 65. Again, 87% of all deaths have come from people over the age of 65. So we will continue to focus on that. And again, our pathway out of this, the bridge, two things. Continue to wear a mask, and at the same time, it's going to be very important for us all to continue to get vaccinations. And I would say that if you have someone in your life or a neighbor who has had trouble navigating the internet or any reason, maybe can't get a ride, any reason can't get a shot, but they qualify, they're over 65, if you can help them do that, that would be a great thing. We spent some time this morning with some of the health departments talking about how we help, and we have ideas, and a lot of the local health departments, a lot of the local mayors are doing some great things. That work will continue as we try to reach those over the age of 65, particularly those who are having a difficulty either getting transportation or difficult time scheduling. So as we start back, I want to read a letter. I'm not going to read the whole letter, but this is just kind of illustrative of how we can get back and move forward. This is a letter I sent out a couple hours ago to minor league baseball teams in Ohio. But the reason I'm reading it is the basic principles apply. We can do this. We can be back and watch baseball this year. We can watch a lot of things. We can watch things that we want to do. We just have to, until we get this herd immunity, we need to continue. We'll have to continue to wear masks. We have to continue to be careful. And I start off, I said, here are some basic principles. And I think when people, ask what can we do, if they just remember these basic principles, I really, and these are not from me, these are from the medical professionals. But I'll just read them. Number one, the virus transmits best by airborne. 2, masks work. 3, distance matters. The further away you are from someone's face, the better off you are. face-to-face. That's how it's transmitted. Time and close proximity to another does matter. The longer you're close to another person who you don't live with, the more dangerous is that encounter. 5, your bubble is smaller than you think. If someone does not live with you in the same home, they're not in your bubble, no matter who they are, no matter how close we are to them. Outdoors is better than indoors is number 6. 7, big indoor areas are better than small indoor areas. And 8, washing hands often and avoiding touching surfaces, both are very, very important. So kind of some basic principles as we move forward. Let me now talk some specifics. Get my notes here, excuse me. Sports and entertainment events will be able to reopen with a 25% maximum indoor capacity and 30% maximum outdoor capacity, provided they follow established protocols. And again, this is a start. As I've expressed to the Reds and the Indians, some of the minor league baseball teams and others, look, we're going to start at this point. If the summer and the spring and summer go the way we think it's going to go, we're going to be able to expand these and move forward. Fundamental precautions must continue to be taken, include mandatory mask wearing for employees and customers, allowing a spectator pathway that allows for social distancing, and seating in groups, pods of no more than 6 people. And the goal is to have those 6 people who are in the same family. Each of these pods are separated from the other pods by the normal social distancing of at least 6 feet. General admission, lawns, standing room infields are allowed as long as masks are worn and 6 feet distancing can be marked and can in fact be maintained. All those seniors who are graduating this year, thinking about their prom, thinking about their graduations, those who are contemplating getting married, we know everyone is eager to make plans. And so again, this is the best we can tell you at this point. And maybe if you're getting married in July, things will be a lot better by then. We hope they will be. We think they will be. And this will be expanded. We hope it's been expanded several times by then. But this is where we are today, and this is what we can tell you today. Again, mask and social distancing are critical to being able to resume these activities. Unless you are actively eating, you'll need to keep a mask on at proms, banquet centers, wedding receptions. Each venue will follow safety guidelines. And we will be putting these out in the next several days, the specifics of this. But I just wanted to tell people this is coming. Proms, banquet centers, wedding receptions, changing the regulations in regard to them. Same way with fairs, festivals, and parades. They're a little different. Particularly, festivals can have a lot of people gathering very, very closely. We know that. So we're working with leaders from the fairs and from festivals, associations, talking to other leaders around the state, talking to members of the General Assembly to come out with the best and safest protocols for our fairs, our festivals, and parades. This is moving quickly, and we will have this guidance out shortly. Someone may ask about amusement parks. Amusement parks are operating under the same guidelines that they asked us to have last year. If they want to change those, they certainly can ask us about that, but we've not received anything from the amusement parks yet. We suspect they'll wait till we get a little closer to the summer. So that's moving forward. We'll have all the details when we put these orders out, but I just wanted to make sure everyone understood this is where we're heading. Lieutenant Governor, I've got a few more things, but if you want to make any kind of comments on that, and then I'll come back.
Yeah. Thank you very much, Governor. I can tell you that there's so many people who were waiting for this day. I know you've received the calls and the texts, and I have too, from people who were looking to plan for the future. And now I think it's reassuring to everybody that the planning can begin, that we can begin down that road back to normal. It's a slow road at this point in time because it's February the 25th. We don't know where things will be in April, but we know things will be. We know that there will things that can begin to be planned for and happen. And I know that talking to moms and dads about graduation and prom, that they are going to be excited to know that they have that future ahead of them. Those opportunities will be available, baseball games, weddings, things like that people want to know that they can plan for, and now they know they can. I think you made some really important points that I want to emphasize, that these events need to still happen safely. We're not there yet with the vaccine. And this is an incentive for everybody to want to get the vaccine, because we watch these, when we see that when you get the vaccine, like we've seen in nursing homes and among our older population, that you see hospitalizations go down, you see cases go down. So as the vaccine becomes more and more available, we need people to take the vaccine so that we can continue to defeat the virus. And that makes the journey back to normal shorter when we can do that. So I know that there are a lot of folks who've been looking forward to this day, to know that they can plan for that future. As we stand here on the 25th of February, this is the start, but it can get better as the circumstances on the ground get better, and we can move away from variances to just general guidance for everybody, so that we don't have to do all of these things on a case-by-case basis. That's the goal, is to set it so that people know the rules and they can plan. And just wanted to make those points, Governor, and I'll give it back to you. And then at the end, I do have some good things to share about some education and job training as well.
Good. Thank you, Lieutenant Governor. So, people will be able to plan for proms. They'll be able to plan for graduation. There's no reason these events cannot occur if we follow basic safety protocols. And we'll have the full details coming up in the next few days. But I wanted to tell people that same way, we can do fairs safely. So that's the good news. More good news.